So today the primary topic of discussion is foxes, and I'm going to talk a little bit about the most common ways, right, that I personally see widely discussed on the internet regarding this particular procedure. So for those who don't know, foxyaz is a lifting effect, right, that we create usually with makeup, and it gives a lifting effect to the outer corner of the eyebrow, right, the tail of the eyebrow and the corner of the eye. We say it gives you that snobby look, right? It creates that slightly more lifted appearance. And this effect has kind of become popular among various types of patients. I won't say the majority, but quite a few patients, especially younger ones. And lately, I've been getting a lot of questions about foxyaz. I did some research online to see what the main ways are, right, that people are posting about. And I saw that there are non-doctors who do foxyaz. There are dermatologists who do foxyaz. There are people who do foxyaz without surgery, using technology, using Botox. In short, there are many ways to do it. So what do I have to say to you about the non-surgical methods, right? The kind where you don't make any incisions anywhere to do it. They work as long as the patient gets Botox, because what really does the trick is the Botox. We block the orbicularis oculi, right, around the eyes, which is the muscle responsible for crow's feet. It's the opposing muscle, the one that pulls the eyebrow down, and we leave the frontalis muscle working. Basically, that's how it works. And then the frontalis muscle will lift the tail of the eyebrow, and with the orbicularis paralyzed, it will be able to create this effect, okay? You have to understand that the effect is kind of like a party trick. It's the result of the muscle blocking action of the toxin. The patient can also combine it with technology like Ultraformer or Morpheus, or even add a little filler under the eyebrow. All of this helps to, let's say, enhance the effect of the lift. If you want a longer lasting effect, if you want this lift to last a bit longer, then ideally you should create a scar, perform a procedure, make an incision somewhere to achieve the lifting effect. Now I'll share with you my own perceptions of what I believe, and then at the end, I'll explain how I do it. I've seen some surgical options where an incision is made up here along the hairline, and each surgeon does it differently. Some detach the skin, others just cut the skin and pull it because they believe that by cutting and pulling the skin, the eyebrow will be lifted. What do I have to say about that? I genuinely do not believe that this particular approach will effectively work. You would absolutely have to use Botox as well anyway, and the significant chance of ending up with a noticeable and unsightly scar is considerably higher, so I truly do not think this is worth even attempting to try. I personally would not do it at all. So what options do you have? You can do a type of Castañares surgery, which I'll show you now. You can do the classic Castañares, which is that incision above the tail of the eyebrow, and then you'll have a scar on top. Or you can do the inverted Castañares, which I've noticed is becoming a big trend coming from Asia to the West with this technique. Instead of making the incision on top, you make the incision underneath. And then what changes is the design, right, that we're going to do, and the amount of skin. Either way, you'll get that effect where it looks like this area is lifted. Another option is to combine the fox eyes with lifting the corner of the eye, which would be a canthopexy. So if you want that lifted outer corner of the eye effect, I always suggest a canthopexy. Without overdoing it, so you don't end up with an odd-looking effect, because I've seen quite a few results that looked strange. And my only caveat with this type of technique is that it will leave a scar. Usually the patients who come to me looking for fox eyes are young patients who don't have drooping eyebrows, who don't have eyelid aging, who don't have excess skin. And they're patients where we can't really predict how the scar will turn out, whether it will heal well or not. I always say that in my practice, Castañares is a technique for older patients, right? Over 50, 60 years old. So for this specific group, I also wouldn't use this technical variation, because the scar will be visible and it doesn't always heal well, okay? This is also my personal perception, it's my personal stance. How do I perform the technique? I really like to use the endoscopic technique, and the endoscopic technique is basically based on performing a deep plane dissection So I make a small incision here within the temporal hairline. It's about 3 centimeters long. We find the dissection plane, which is usually what we call below the superficial temporal fascia. It lies between the layers of the temporalis muscle, and we dissect this plane until we reach this ligament, which is what you're seeing in the photo. What holds the eyebrow down is exactly this bony adhesion that remains. When you release the bony adhesion, the eyebrow will automatically rise, and then we can position it wherever we want, lower, more natural. So each person can do it, can position it however they think is best. So I prefer the Castañares technique done this way. There's a reason for that. It's a more anatomical technique which follows anatomical principles. It doesn't leave a visible scar, and it's done very safely, especially if you do it with the help of a video endoscope, which is when we can actually see where everything is, right? Where the position is, where the ligament is. We can see the structures, we can release them, and from there I can derive several things. I can detach the rest of the forehead, I can treat the muscles, I can lift the cheekbone, and then I can keep advancing the technique using video assistance. But the basic principle for performing the Castañares technique is this. It's to release this ligamentous adhesion that sits here on the bony rim at the side of the eyebrow. That's the principle of the technique for achieving the lift. Then you don't need Botox. The effect will last without, and even despite Botox. And then the indication for Botox goes back to its traditional use, which is to prevent the patient from developing crow's feet. None of the techniques we use aim to cut this muscle because it's a very thin muscle. The skin is very thin. And when the muscle recovers, it doesn't always return symmetrically. So I still think it's more reliable to go back to Botox if you want to get rid of crow's feet, but the position of the eyebrow will already be in the right place, and we have complete control to set it at whatever height we want, okay? So that's the way I find most interesting. This is a patient for whom I treated the entire forehead. I didn't just do the elevation of the corner. You can see that she's a patient who already has some drooping of the eyebrow. Her eyebrow is a bit more straightened. And when the eyebrow is lower, it ends up giving the impression that the person is tired because it looks kind of heavy. And when you take the weight off the gaze, we can improve the appearance of this area. And then I can leave the tail of the eyebrow higher, more straightened. I can simply just release the ligaments and take the weight off the gaze. And it's normal in this type of patient when we lift the eyebrow for the hollowing of the orbit to appear. And then we combine it with a fat graft, which you also already know I really like. With each procedure I add, with each area of the forehead that I treat, I add a certain type of result. And what's important to make clear, you don't need to do everything for everyone. Usually, these younger patients who only want the effect of lifting the lateral corner, right? Who just want that Fox S effect, who don't have aging, who don't have sagging, just releasing the tail of the eyebrow, just releasing the ligament will already solve it. And then I secure it, right? With a suture to create the effect of symmetry. Because it's as if I'm telling the body, you know, like, look, I want you to stick this area right here. The suture isn't meant to do the pulling. The incision in the skin isn't for pulling either. It's to stabilize the flap. What actually creates the lift is releasing the ligament. Once you release the ligament, which is what holds the structures above the skin, the tail of the eyebrow naturally lifts. It's really interesting that when we look at the anatomy and understand the principle behind it, then we can start to figure out what works and what doesn't, and how it's actually going to be effective and help the patients. Another thing I see a lot is people putting on a bunch of micropore tape, all sorts of things to hold something in place. There's no need to use micropore, no need to, I don't know, put tape or anything, because what's going to hold the tissues in place is the actual release of the ligament itself. There's no risk of the scar looking unsightly or the patient ending up with a bald spot because there's no tension on the skin. The skin is actually left with some slack. It's actually the opposite. When I release the ligament and the skin lifts, the patient will notice there's a slightly soft area here just behind the hairline, which is where the excess skin is. Since the skin is somewhat inelastic, it eventually settles and the puffiness will disappear after a few weeks. But this gives me a lot of confidence to say that there's no risk of scarring issues, no risk of hair loss, and no risk of the patient ending up with an unsightly scar. What is the recovery time? Well, you can have the procedure done on a Friday and be back at work by Monday. You'll have this area a little swollen. You can see that it gets a bit puffy. Usually when I perform a very targeted temporal lift with this goal, I always separate a little towards the forehead and a little towards the mid-face to create that uniform swelling effect. And the healing ends up being better, but the patient on Monday just lets her hair down a bit and she can work without any problem. What kind of care is needed? Be careful not to press on this area, and I ask that you avoid sleeping on your side for at least 14 days. Tati, after how many days are the stitches removed? Do you use bandages? So I don't use bandages, I don't use surgical tape, I don't use any wrapping, and I remove the stitches between 7 and 14 days. They're simple stitches made with nylon, and they're just to bring the edges of the incision together, all right? So that was my message for today. I wanted to talk a little about the technical variations of the Fox S, what works, and what kind of results you can expect from each of them.